All right. Well, welcome to week 5 and welcome to Dr. Morton Ford's class as well, hoping that she is safe. Um, all right. I'm just looking through, just make sure that your first and last name are all Pamela. Can you add your last name to your login, please? I think everybody is. Else is okay. I'm just doing a quick run through, make sure. And Aliuska, if you can add your last name as well, that would be awesome. This way, you guys make sure you guys get a credit for attendance tonight. Everybody's. I'm okay. All right. A lot of people on my screen tonight. All right. I'm trying to find Pamela. I know you're here. Um, all right. So we are gonna, oh wait, got more coming in. Okay. All right, so we're going to go ahead and get started. So again, welcome to week 5. I hope everybody is having a wonderful nurses week so far. If I don't know if I know some of the campuses are having some activities, so just hope you're having a good week. That's all. All right, so we are gearing up for exam 2. Um, so again, welcome to the other cohort as well. Quick announcement for my group. I know we're gearing up for exam 2, but if you need to and you have not met with me regarding exam 1, please send me an email with some days and times that you are available so we can go over misconcepts. You will see those concepts again, right? Especially when it comes to HESI. So I want to make sure that we go over those misconcepts. So please send me an email with some days and times that you are available, so that we can meet and go over those misconcepts. So getting started. So what we have for tonight. So we're going to talk about chapter 17 in your Success in Practical Vocational Nursing text. It is all about leading and managing. We'll also talk about assignment and delegation. Okay, thank you. And so and then at the end, we will have some practice questions on gosh, on assignment and delegation. For some reason, my tongue is all twisted this afternoon. So that is the plan for tonight. So again, I'm going to share the screen. We're going to talk about chapter 17. And then once we get through chapter 17, we are going to do some practice questions on assigning and delegation, mostly a delegation, but I might have some assigning questions in there for you. All right, so I am going to share my screen, maybe, if my computer wants to assist in this process. And those who don't know me, I apologize. Let me, I probably should have said, hi, I'm Mrs. Martinez. I will be with you guys tonight. And welcome to our class. I appreciate y'all being here. So with that being said, sorry, I missed that whole part. Should have introduced myself, right? That's one of the first things we're supposed to do. All right. So this is an organizational chart. Has anybody ever seen one of these before? Has anybody ever seen an org chart before? Some people may have, some may not. Why is the org chart important to know?
Delegation, to know who's higher up in management.
Absolutely, right? So, right, something happens and you need to know who to report to, right? That is what the importance of this wonderful organizational chart is. And so this is a generic chart, okay? Um, so Here we have the owner of the nursing home, we have our board of directors, and then we have all the different departments. And since we're going to be nurses, we have it broken down. So, director of nurses is usually going to be the one that is in charge of the nursing department. Under her, there's a nurse manager, charge nurses, and our wonderful nursing assistants, right? Some things may be a little bit different. Instead of a nurse manager, maybe there's an assistant director of nurses. There may be a nurse supervisor that falls into this, but generally speaking, okay. Understanding where you fall on your organizational chart is going to be important, right? Because, like, you have to know one, who reports to you and who do you report to? And if something happens and you need assistance or you need to report something or something happens, whatever the case may be, right? You need to know who that goes, who the next person in line is. Some of these are going to be very intense. Some of them may be a little bit more simplified. Again, it depends on where you work. It depends on the size of your facility that you work in, right? Imagine a hospital, right? Hospital is going to be a huge, nice little chain of command or org chart, right? But in a smaller long-term care facility, right, you may have a smaller org chart. So when we look at leading and managing, all right, so there is a difference between a leader and a manager, okay? And so when we look at this, management is the organization of all care required for clients, right? And so, generally speaking, the focus of management is planning and directing to make sure that we're meeting the client as well as the institutional outcomes. The manager asks how, when, right? They have their eye on that bottom line. And so they're very task oriented. They also provide some discipline. They have power and control. They can teach or instruct others. Managers always have subordinates, so they'll have people that report directly to them. They are supervisors, and again, they're goal setting, right? And then they're going to measure those goals. Leaders, on the other hand, is how a person empowers and develops a team to meet and exceed their client and institutional outcomes. Okay, so leaders are people oriented, they're motivators, they have vision and strategy, they listen, they empower others, they have followers, they're delegators, they're goal exploring, and they're reflecting. One of the key things about one of the key differences between leaders and managers too is we can teach someone to be a manager, right? They have specific things that they need to accomplish throughout the day. Um, and so we can teach someone to be a manager. Leaders, not so much, right? So leaders are a little bit different. Okay, this is your personality. And so, these are things that you learn inside through your experiences and how you choose to lead people. So there is a difference between leaders and leadership and management. So again, management coordinates people, time, supplies to achieve those desired outcomes. They have an appointed management position in a formal line of authority and accountability. Whereas, like I said, leadership is a process. It requires, skills. It's something that involves over time, but they have the ability to empower and influence the beliefs, opinions, or behaviors of a person or a group by guiding, motivating, and inspiring them to accomplish common goals and recognizing their successes. They don't always have formal authority. But are still able to influence others. So when we talk about informal leaders, what is an informal leader?
Mhm. Would that be somebody that's Leader, but not formally like having the title or something like that.
So yeah, so raise your hand if you're a CNA. Anybody CNAs? All right. So I'm going to use CNAs as an example because it's usually a good one, right? We all know that one CNA, and it may be you, but I don't know. I'm just saying, right? We all know that one CNA that knows everything, right? She knows where all the supplies are. She knows all the right people to go to when you need things, right? But she's not an official, senior CNA or she's not an official leader, right? But everybody knows that she's the one to go to, right? When you need something, right? That would be an unofficial or an informal leader, right? They don't have the title, but they're a wonderful resource for everybody else. They, are encouraging, they're empowering to other people. And so that is what would be considered an informal leader. We have different leadership styles. And so we look at leadership styles, there's a couple different ones out there, right? And so when we look at different leadership styles, first one is autocratic, right? So that autocratic style, they're the ones that are more focused on the task, okay? So they're the ones that are out there and they're saying, all right, Christina, you're going to do vital signs today. And Shadiamond, you're going to do all the treatments today. And Nicole, you've got all the medications. And then maybe Destiny, you're going to get all the blood sugars and do all the insulins, right? So it's very task oriented. They're kind of just telling people what they're going to do, right? And if anybody's been in the military, that's kind of how the military runs, right? It's like barking orders, right? This is what you're going to do. When we look at Democratic leaders, okay, Democratic leaders are a little bit different. They balance concerns with the task as well as the employee. All right. So, all right, let's say we have a lot of falls this week, okay? And so I'm going to bring the group in together and we're all going to discuss what's going on, okay? So, maybe, what are some things that we can put into play to help decrease the amount of falls, right? And so we're going to brainstorm. We're going to brainstorm as a group. So that democratic style, it balances concern with the task as well as the employee, right? Want to get input. I want to get, you guys have ownership. And so we're going to all come together and we're going to work together towards meeting the goals of the client care as well as the organization. What do you hear when you hear the term laissez-faire?
Lazy.
To me, I think they kind of lazy, laid back.
Right. And so a lot of people here, right? They hear lazy. Laissez-faire is more concerned with the employee. Okay. They want to keep all the employees happy. All right. So they're not really directing, they're not really taking, they're just kind of letting, they're focusing on on people's feelings versus what tasks are. And so it allows the employees to kind of act without any kind of direction. So they kind of do their own thing. Now, with that being said, all three of these different styles have a good place in a work environment. Okay. So again, autocratic styles, they don't share responsibility and authority with employees. The emphasis here is going to be on their policies. And they tell employees what tasks to do. They don't seek any input from the task. So again, it's more like an order, like that military type, right? They can be, they may be able to reach their goals. Where this style of leadership is really good, though, is in crisis situations, in code situations, in emergency situations, where we need someone to take charge and to direct people, right? Instead of everybody running around and nobody's really knowing what to do, right? We need one person. Okay. Let's see. Ebony, you're going to go call 911. Nancy, you go grab the code card, right? Vanessa, go get the backboard, whatever it is, right? And then everybody else, Lillian, Katrina, Nicole, Kizzy, all y'all are going to make sure all the residents are out of their rooms in a nice, safe space, right? So autocratic leadership in that situation, right? That's a good style to have. Laissez-faire gives away responsibilities to the employees and puts employees before policy, and it's just a people pleaser, right? I want everybody to be happy, and everybody is kind of just doing their own thing. When agency goals and policies aren't a consideration, then this is fine, right? There may be a day where everything is just running great and, we really don't have to have any formal direction, right? That may be a good time where we know, there's no specific tasks that need to get done. It's just a normal everyday and everything is going smoothly. I really don't need to be out there, directing traffic, right? So that could be a time where a laissez-faire leadership style may be okay. The most preferred leadership style, especially from employees, is going to be that democratic. Okay, so they share responsibility and authority with employees. They enforce policies, but they're also concerned with the employees. They seek input from employees. They encourage problem solving. And then because of involvement of employees, goals are achieved with positive staff feelings. And so this is normal day operations, right? Daily nursing care, meetings, committees, review of care plans. This is where that democratic leadership style really plays into or really comes into play, right? Like I said earlier, we have a large amount of falls, we have a large amount of pressure areas. All of a sudden, we've had an increase. Let's bring team together. Let's brainstorm, right? What are some ways that we can try to figure out what's going on and prevent more falls, more pressure areas from occurring? So it's taking that group of people together. It's encouraging them, help them, help with problem solving. So then we have situational leadership. Okay. And this is where the majority of our leaders are. Okay. So the leadership, meaning the leadership style, is going to be based off of the situation, right? What's going on at work, right? So I may be a democratic leader, but let's say we have a code blue. Now I need to be an autocratic leader. I need to start directing people, right? And again, or it could be, maybe everybody's having a bad day at work and nobody's getting anything done. And I need to be like, okay, we need to take a timeout and I need to start assigning people responsibilities. Okay, so again, the situation leadership is going to vary. And this is where most people are, right? Most people are going to vary their leadership style according to the situation. In some cases, it may even vary according to the employee that you're dealing with, right? You may have some employees that you can use a very democratic style with because you know that they're going to continue to get the job done. Whereas you may have some employees that need to be, have a very structured day, right? You need to tell them exactly what they need to do throughout the day. So when we look in knowledge and skills, so some of the key knowledge and skills that as of a good leader. And so as future LPNs, LVNs, you are going to be a leader at some point. You will have CNAs that directly report to you, and you need to be able to lead them effectively. Okay, so core knowledge and skills, motivation. All right, you need to motivate your team members to accomplish goals. You need to communicate clearly. You need to be able to problem solve effectively. You need to effectively build your team, and you will have to manage stress effectively. All right, and so when we look at this, what are some ways that you can motivate people? How can we motivate people?
Maybe interacting with them If they
Okay,
need
interacting with them.
if they need to do something that they're not feel confident or they don't like to do, or maybe they don't know, maybe show them and teach them, or doing it with them in that way they motivate and do it and see it from other point of view.
That's a good one. That's very good. Absolutely.
Or sometimes when they're doing good job, rewarding them or encouraging them more.
Okay, rewarding, encouraging. Yes, encouragement is a big part of that, right? So yeah, absolutely. So, another one too is, and I think somebody said this, be optimistic and enthusiastic, right? You set the example. Okay, that's a big thing to remember. And I'm sure we've all had that one person, whether if you've, whatever job that you've had, you ever worked in, they come into work and they're like, and you say good morning, and they're like, yeah, morning, and they're just down in the dumps. They don't want to be there, right? They've just got this really bad attitude about being at work, right? And I'm sure everybody has worked with somebody like that or been around somebody like that. That's just a constant Debbie Downer, right? If you go in there as a leader, how is your staff going to respond to that? How are they going to be?
Negative.
They're going to be negative too, right? Well, shoot, if the manager doesn't want to be here, what makes me want to be here, right? What makes me want to do a good job? And I'm not saying everybody doesn't have bad days, right? But if you're constantly setting that example, when, oh, I'm here, yeah, let's just get it. I can't wait for this shift to be over, and it just started, right? Um, so be optimistic, be enthusiastic, be proud of your job, right? You chose your job. Your job doesn't choose you, right? You choose your job, right? You go interview for the jobs that you want. And so you should be enthusiastic about it. And that is going to set the tone for that whole unit. And somebody else said it too, encourage them, highlight them, reward positive outcomes. And I'm not saying you have to go buy yourself pizza every week, but just little things like, thank you. Hey, you did a really good job today. Whatever it is, be positive, be encouraging. And you set the model, right? You are the model, you set the standards. Communication is always a big part of everything that we do, and we need to be able to communicate effectively. Problem solving also too, right? Use your problem solving steps. What can we do for team building? This is always a difficult one, right? But what can we do to help build a team?
Listening.
Okay, listening, that's always a good one, right? Let's listen. Yeah, I like that. Let's listen.
Knowing their strength and their weakness, so we can help them and maybe assign tasks that it would help them to develop the skill, being able to include everybody on that needs to be included.
I would say like have meetings as well,
Yeah,
like
to
Yeah,
team meeting.
discuss advantages and disadvantages.
yeah. And
You could do like
meetings
a
don't
lunch.
have to go ahead. I'm sorry.
Sorry, I said like you could do like a lunch or a breakfast where everybody like comes together and
Yeah. And
chats and meets.
yeah, and it doesn't have to be like meetings, for example, right? Your meeting doesn't have to be 4 hours long, right? You can do a quick huddle every morning, right? Before you go out, like, hey, this is what we're going to do today. We're going to have a great day, right? We're going to get it done, right? You want to build the teamwork. You want to build collaboration, right? We want everybody to work well together. Now we know not everybody is always going to get along, okay? And I'm not saying everybody's going to get in a circle and sing kumbaya, right? But building that professional relationship is key because we all have that common goal, and that common goal is to provide that quality care to our clients. Suggestion box, I love it. Yes, absolutely. A suggestion box, right? especially an anonymous suggestion box. People are more likely to suggest things if it is anonymous, right? So that if, if nobody likes their idea, they don't get, somebody pinned on them. So yes. But yes, we want to build that team. And then stress management. And this is a big one. And we'll talk about this a little bit later in the chapter. But when we look at stress management, it's not just our stress, okay, that we have to deal with as leaders or managers. We're going to have to deal with the stress of those that work with us, for us, sometimes even our clients. And so, really being able to effectively manage stress on a on a unit or even in individual members is going to be very important. So, tell me, what are some ways that you guys manage stress?
Like for me, I'm a manager at my job. So I'm like over the med techs and the RA. So we have like a walking trail. So like when I get really overwhelmed, I just go out on the walking trail, just give myself a moment, just because I have to deal with the doctors, the staff, the family members, the residents. I mean, just so much. So I just walk.
That's
That's
a
how I
good
do.
one. Walking exercise is a really good, effective stress manager or coping mechanism. What else? Anybody else have any good stress coping mechanisms? Music, venting. Those are all good, right? Call your best friend on the phone, call your mom, call your spouse, whatever, right? I just need to vent and da 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 da, right? I've done that. My poor husband, he's been yelled at a lot. And not usually for something he did, just because I needed to vent. Um, yeah, so music, venting, walking or exercise. Some people like to garden. What else? Meditate. Some like to journal. Sometimes journaling is effective. Um, there was something else I wanted to say. Yoga is another effective coping mechanism. Good, yeah. So again, we are looking for positive coping mechanisms. Right now, you may not, you get frustrated at work, you may not be able to go and, do your yoga, but sometimes like Kenyatta was saying, is it Kenyatta? Did I say that correctly?
Yes, ma'am.
Okay. Like she was saying, going for a walk. Sometimes just stepping away, going into the restroom, closing the door, taking a few deep breaths, right? Can just get yourself together, might be effective. So we have to be able to manage stress. Nursing is a stressful environment, right? Even nursing school, I hear, is very stressful, right? So having some ways to relieve your stress that are positive, that are not going to hurt you. Okay. So trying to avoid the negative ones like the drinking and the smoking and other things, right? We want to look for those positive stress management skills. When we look at motivation, and motivation is something that as a leader or even something for ourselves, okay? Motivation is the drive that causes us to set personal goals and to behave in a way that will allow us to reach those goals, okay? And so the drive comes from within as an individual, and that is our intrinsic factors. All right. And so intrinsic factors or motivating factors, they help to improve job satisfaction, right? As well as to contribute to personal growth. So achievements, right? Recognition, the value of the work, right? We have to want to love what we do, right? To do what we do, right? Because it's a lot of hard work when you become a nurse. Um, Potential for growth and advancement and responsibility. Those are, some of those intrinsic. The extrinsic factors, okay, these are maintenance factors or what we call dissatisfiers. These are the things that will decrease job satisfaction, not dissatisfaction. So some of the things that could cause that: company policies, administration, supervision, our salaries, our interpersonal relations, our work conditions, right? All of these have an effect on us. All right. And so when we look at that, as a leader, we have to address both of these in people, right? Not only those intrinsic factors, but we also have to address the extrinsic factors as well. And how can we help make it a better workplace? And we know that there's not ever going to be the perfect workplace, okay? Right? But as future leaders, future managers, right? We try to, we talked about where do we go right here, right? Talked about team building and motivation and problem solving, right? So how do we make it better? So some job satisfaction attributes, value, right? Do you feel valued as an employee? Do you add value to the workplace? Do they have opportunities for growth? Developing a real connection with your fellow staff members or and I hate the word subordinates, and I can't think of another word right now. But those that you work with, let's just put it that way. Is it empowering, right? What does it mean to empower somebody?
I, to me, I would say empowering someone means that you're lifting them up. You're giving them, motivation or for lack of better words, maybe giving them their kudos, giving them the encouragement that they don't need to, to go on.
Absolutely. That was perfect. And then Lillian said it to make them feel important, right? Nobody wants to feel insignificant, right? That they're not part of the team, right? Empower them and make them feel like they're part of a team. That's super important. Nobody wants to go to work and feel like an outsider, right? We want to build connections. Job dissatisfiers. All right. Availability of equipment. So I was telling my class earlier, I moved here. So I live in Texas now. I lived in Virginia for 30 years, and that is where I started my nursing career. And so my nursing background is long-term care and pediatrics. And so I've been in a variety of nursing homes, and always had things like, vital signs machines. Okay. So when I moved to Texas and I started working in long-term care, because I love long-term care. I was in orientation, and of course, you get your list of vital signs. You have to go take your vital signs. And so I'm looking around the unit, and the person that was orienting me, he was like, well, what are you looking for? And I was like, I'm looking for the vital signs machines, so I can go do this list of vitals. Because I work skilled care and they require, Q-Chef vitals. And he's like, we don't have those here. And I'm like, what? um, so yes, they don't provide vital signs machines. So vital signs is we have to have our own equipment. So my own blood pressure cuff, my own thermometer, my own uh, oh my Lord, pulse ox, right? All of that stuff. So it was a little bit different, but availability of equipment is a big deal. And it's not always just a vital signs machine, right? It could be your wound care supplies. It could be um, tube feeding supplies. It could be linen, right? I don't know how many people have, I noticed there was, few of you are CNAs, right? How many times have you run out of linen on your shift and you're like, how am I supposed to even care for my clients if I don't have linen to give them a bath, right? And I have worked in facilities where that is a huge issue, right? So that is a potential, right? So that's a job dissatisfier if you don't have the things needed to do your job. Unrealistic workload, staffing, right? If I am, have 60 bed facility and I have 2 CNAs, it's a really unrealistic workload, right? And then the regulatory demands or the paperwork. And I've worked in facilities where the charting is very minimal, and I've worked in facilities where it's taken me 2 hours, sometimes 3 hours to do all my documentation for my shift. So, depending on what those regulatory demands are, it can be a huge job to satisfy, right? If I have to sit down and do paperwork for the majority of my shift and I'm not able to interact with my clients, right? That to me would be a dissatisfier. Also talked about communication skills, right? Those wonderful active listening skills. And so, our verbal and our nonverbal, we need to be able to express ourselves. I can't even talk, and I'm talking about communication. We need to be able to express ourselves effectively, right? And one of the key aspects of that is making sure that our verbal as well as our nonverbal communication, right? That they are cohesive, that they're not giving conflicting messages, right? And so if I'm sitting here like this and I'm talking to you and I'm like, yeah, I really want to make sure that you guys understand this topic and it's really important to me. Does that make you feel like I really care that you understand this topic, right? I'm not even looking at you when I'm talking, right? I'm looking every which way. It is the same thing when we're speaking with our colleagues, when we're speaking with our clients. We want to make sure that our verbal and our nonverbal are cohesive, right? That they complement each other, that we're not giving them mixed signals. Written communication as well, right? So written communication, we will absolutely communicate written, whether it's through nurses' notes. You may also, you may communicate via text message. You also may communicate via email. And so, sometimes you may even have to write like a miniature, an in-service for staff, right? So we always want to make sure that we use appropriate language that the staff is going to understand. Always review what you post. Use spell check, use grammar check. So you want to make sure, have somebody else proofread as well. That's always key. And then make sure that is clear and understandable. Um, I was telling a story earlier. One of the facilities that I worked at, we had iPhones. They were encrypted phones, so we could we could text providers, patient information, things like that. And so I had an incident at work one day, and I had, addressed the situation. I had assessed the patient. I had gotten orders. I was waiting for transport to come and get them to take them to the emergency room. And in the process, I was texting the DON just to let her know, like, hey, this is kind of what's going on. But I was rushing because, just when I thought I had a minute to do this, of course, transport had gotten there. And so I was texting really quick, just kind of, and hit send. And I went, got the patient out the door. And so I go back to pick up the phone and I see that there's a message from my DON. And all it said was what, with a question, like about 10 question marks. And so I go back and I look at my text message. Autocorrect is a horrible thing sometimes. I just want you to know it is a horrible thing. And so it had auto corrected. And I don't know who, there's like a dozen people that use this phone. So some of the words I was a little concerned, like, why did it autocorrect to that? And I just started laughing. I was like, yeah, that's because I was rushing and I wasn't paying attention. So I had to retype it out. And I was like, autocorrect is not my friend today. Which got a laugh, but still, right? We want to be careful with that. If you have a meeting, okay, just like with our clients, right? When we provide education, we provide it verbally and we provide it written as well. If you have a meeting, okay, make sure you have a typed report, right, that somebody can go back to with the meeting minutes. Talking on the phone. Always gather your thoughts, right? That, why are you calling? And you can tell when somebody is happy, sad, smiling. crying, whatever on the phone. You can tell, right? So you always want to make sure that, when you're speaking over the telephone, that you present yourself as happy, especially if you have to call a staff member, like, I need some staff to come in this afternoon. I don't want to be like all down in the dumps and be like, hey, this is Jennifer. I'm calling from work, and I need to know if you can work this afternoon, right? You want to be happy, right? And again, you want to speak clearly, use effective language. And I would tell you, I don't like talking on the phone. I'm much better. Just send me a text message. But okay, when you're gonna have to talk to people on the phone, you may have to talk to doctors, providers, family members, staff members, right? So just try to get comfortable with the phone. Um, and then, of course, active listening. We've talked about active listening skills. You want to use all your good active listening skills, making sure that we're hearing and we are understanding. And a lot of this, we're talking about dealing with other staff or other staff members, okay, not just necessarily working with clients. All right. So, still, as a leader, you're going to have to use your active listening skills when you're dealing with your CNAs or even other nurses. Oh, excuse me. All right. So again, just to touch on a couple of those others, stress management. And that's part of all work environments, not just nursing. Okay. Although we know that nursing can be very stressful. And so, lots of, it could be because of increased workload, because maybe you had some CNAs that called out and now we have to redistribute the patient care. We also, there could be conflicts with family members, healthcare providers, even sometimes with their clients or our residents, right? And so stress is part of it. And so some of dysfunctional job behaviors that can occur because of stress, decreased performance, right? If it's overly stressful, they may not perform, your CNAs may not perform up to their abilities. It can also lead to negative interactions, poor communication, inappropriate body cues, right? They may not speak to each other appropriately. It could also lead to a high staff turnover. We already know in a lot of places, right? There is always some places have a very high staff turnover. So we need to be able to try to create that less stress in that work environment. They also, try to guide and control our CNAs, right? Help them to deal with stress, and be able to identify signs of stress. When we can identify the stress in that clinical environment, right, then we can offer some ways to decrease that stress. And that brings us to this ABCD. ABCD. So the ABCD ways of controlling irrational thinking. And so irrational thinking is, how do I explain this? So it's part of stress and it is reacting incorrectly to a situation that is occurring. Okay. So we have A as your activating event. B is the belief or the self-talk about the situation. C are the consequences. And then D is your dispute, irrational thoughts. And so I'm going to use the example that is in the textbook for this one to make it make sense. All right. So activating event, you have a CNA that calls in sick, says, "Hey, I'm not going to be in I'm not going to be in today. I have a headache." All right. And so the belief or the self-talk about the situation would be the charge nurse thinking that, the CNA was out partying the night before, and that's why she's not coming into work. And that's why she has a headache and she can't come to work. The consequence The manager was abrupt with the CNA on the telephone. She allowed herself to feel angry about the absence, and then the charge nurse allowed it to ruin her whole day. And then the nursing assistants avoided her like the plague, right? Because she allowed that negative self-talk to interfere with her day. So dispute irrational thoughts. All right. Choose a more rational, assertive response to the situation rather than, yeah, I bet you just have a headache because you were out partying all night. Okay. Focus on the facts. She has, the nursing assistant had a headache. All right. So best response is, all right. I'm sorry you have a headache. I hope you feel better. Thank you for calling and let us know. Right. That is all really that you need to do. Getting upset about the situation really isn't going to help you because there's really nothing you can do, right? You can't make her come into work, right? And now you're upset because for what? Absolutely nothing, right? There's nothing that you can do about the situation. Okay. Self-talk, we do make judgments sometimes, not going to lie, right? We all have those moments, but you want to try to avoid those negative self-talks. Even if you saw that she posted on social media, right, that she was at a concert last night or she was out partying, it's not for you to why have it ruin your day? And like I said, it's going to have a trickle down effect on your staff. So creating that less stressful environment. All right. Organize your shift. Time management is always going to be key here. Organize your shift. That will prevent some stressful situations. So, your time management skills, your organizational skills are going to play a huge part in this. Now, is this going to happen your first day on the job? Absolutely not. It's going to take some time, right? Once you get in, you have orientation and you know what your expectations are, then you can formulate a plan so that you can organize your day effectively. Doesn't always mean that something's not going to throw a wrench in it, but you'll have a plan. Make sure that your CNAs or your nursing assistants have the adequate resources so that they can get their job done, right? Making sure that they have their linen, that they have all their personal care items, right? That the shower chairs are where they're supposed to be. All of those things. If they have the resources to get their job done, then they're going to get their job done a lot more effectively. Make sure they take their breaks. This is a big one. Okay. So when I would make my CNA assignments for the day, I would assign them a lunch break. Okay. Didn't always mean that they went exactly at that time, but usually within 10 or 15 minutes of that time they would go, right? Because we know CNAs have to be on the unit for meal times, right? So they can't be off the floor for meal times. So I would schedule them sometimes like half of them before lunch, the other half after lunch, and then I would switch it up. So not everybody had the same lunch, right? And if there was a reason, I could switch it up as well. But my goal is everybody got their lunch break. That is a big thing. Everybody needs a break. That includes you as a nurse. Okay. You're entitled to your breaks as well. And you should take them. But they need to take their breaks and you need to make sure that they take their breaks. Create a calm environment. And this is one of those things. And this is where, like we were saying earlier, you set the tone for your unit. Okay. You come in with a smile, you're optimistic, and you're happy to be at work. That is going to set the tone for the others, whether whether you see it initially or not, that is going to definitely set the tone. And be calm. If, we all have seen that one person that runs around work like a chicken with their head cut off all the time, right? Always seems like they're just all over the place. That's going to cause chaos. Okay. So you want to try to create a calm environment and treat your CNAs with respect. Who are my CNAs again? Raise your hand if you're a CNA. See these people raising their hands? They work their butts off. Okay. CNAs spend more time with the residents or the patients than even the nurses do. They work very hard. They do a lot. It is very physically demanding work and they're underpaid. Yes, I will say CNAs are underpaid for the work that they do. Treat them with respect. say please, say thank you. They're not there to do your bidding. They have their own tasks to do. Okay. And they deserve to be treated with respect. I'm not saying you bring them pizza and donuts every shift, okay? But please and thank you. Hey, you did a good job. All those words do go, pretty far. So when something does happen, all right, so we have an issue, or, there is some sort of conflict on the unit, then we want to use our problem solving skills. And so problem solving does have a step process. All right. And so that step process is is a lot like your nursing process. All right. So the first step is going to be to collect data. All right. So let's say you have two CNAs that get into an argument about whatever it is. Okay. When you're getting your data, you want to, pull each one of those CNAs aside. You want to get them separate from each other, separate from the problem, and you want to figure out what happened. We know that there's two sides to every story, right? So that is why we separate. We get all of the facts, okay? Then we state the problem. Okay, so after hearing, from CNA A and CNA B, we've got all those facts. Then we want to identify what that problem was. Use I statements like I understand that blah, 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 right? This is what the situation is. And then making sure that you understand it. And that is where we set a goal. Okay, and whatever the goal is that they're going to get along on their shift, whatever the goal is. And we're going to do interventions, much like we do with our nursing care plan, right? We're going to get both of the CNAs together that were had a conflict, and we're going to select interventions. We always want to be positive with our problem solving. We don't ever want to feel like we're favoring one person over another. We want to have a nice win-win situation. Okay. Usually that is going to involve some sort of compromise. Okay. And then put all of those interventions and have a plan for evaluation. And so, whatever it is, it could be you've got two residents that are arguing and fighting, and you're trying to figure out how to make both of those patients happy. Okay. So, again, problem solving steps are really important. They are much like the wonderful nursing process that we use. And this will help when you have conflict, whether it's between staff members. And like I said, sometimes it could be between residents, especially in long-term care. Other specific knowledge and skills you would need to be an effective leader, to be an effective manager. You need to have the knowledge and skills of nursing. Okay. Documentation, federal regulations, legal aspects. Documentation is such a big part. Everybody's heard the term, if it wasn't documented, it wasn't done, right? Make sure that you always document appropriately and accurately. As you get into practice, and depending on where it is that you are going to work, you're going to learn more about legal and federal regulations. Federal regulations are similar in a lot of places, but also can be different depending on the setting that you're working in. Need to have really good organizational skills. Time management is key. Depending on what shift, and where you're working, whether it's 8-hour shifts or 12-hour shifts, time management is going to be key. You would be amazed to see how fast time goes by when you're very busy. And you think you have all this time to get everything done, and it goes by quick. CQI is another thing. Continuous quality improvement. We're always striving to make things better, okay? To do things better, to find ways to make it better. So continuous quality improvement. This is a committee, the CQI committee. You may be asked as a new nurse to join and be part of the CQI. And what the CQI does is they will go and look at things that have happened. So whether it's falls, whether it's pressure areas, whether it's infections, whatever it is, okay, they're going to bring a group of people together and they are going to review these incidents, okay, and come up with ways to prevent them from happening again. So it's a lot of out of the box thinking. And again, it is something that you may be asked to join. Conflict resolution is another big one. Handling conflict. Conflict can occur when two or more persons interact, and we know, and then conflict can arise within nursing assistants, with staff, with residents, with families, healthcare providers. And I mean, it's not, and I'll be honest, conflict isn't always a bad thing, right? Sometimes it's an opportunity where we can grow and learn from a situation. It's
I have
not
no
always a
seatbelt on.
bad
I
thing.
put it on.
And so, but we also don't want to leave conflicts unresolved. Okay. We want to resolve conflicts because unsettled conflicts, right, it can grow into something bigger and, eventually become completely impossible to resolve. So we want to always try to resolve conflicts as soon as they happen. Other skills to have, we need to have human relationship skills. So you need to be able to not only get along with, your CNAs and other staff, but we also have to relate to families, to residents. And this includes anger management. Um, anger management, whether it's for you or even sometimes with another person. Um, so you have to, again, that's you're aggressive and you're assertive. We need to find ways to make sure that we are expressing ourselves in professional manner at all times. You will also be responsible for performance evaluation of your nursing assistant. We talked about empowerment, and read here, increasing self-confidence. And we talked about this a little bit. I don't remember who said it, but somebody said it. Um, we look at increasing self-confidence in team members, right? Let's say you have, a CNA who is just really unsure of herself, even though she seems to be doing a good job, right? Help her out, right? Help her improve her skills. This could be even, once you've been a nurse for a while and you have a new nurse that comes in and is a little unsure of themselves, right? You can take them under your wing and help them improve, right? So that is part of it. Um, and then being non-judgmental. And I know sometimes this is really hard. And I've been in situations too where and I'm like, how is it that you don't know that? But we have to know, right? Everybody has their own level of experience and, their knowledge base. So we try to be non-judgmental and just again, try to increase their confidence and their abilities. All right. And that is going to bring us to where I want us to be, which is going to be all about assignment and delegation. However, I will give you guys a break. So let's be back at 6:40. All right. If you didn't see my message for Dr. Ford's group, she is ready and safe. So you guys can leave my Zoom and go join Dr. Ford. But it was a pleasure to meet all of you.
You as
Thank
well.
you.
Thank
You as
you.
well.
Um,
Have a good one.
you
Nice
too.
meeting you. Have a good night.
Thank you
Oh,
too.
hello.
Hello.
Hey, what's going on?
If you're in Dr. Ford's class, she is safe and she's gonna take her class back.
Oh, okay.
So you can log on to her
Oh,
Zoom.
okay. Thanks. Oh.
All right, so let's finish up. Nicole, where's Nicole? Nicole. Where's she go? There you are. I answered you. Is that good? I'm so sorry. All right.
Yes, that's fine.
Perfect. All right. All right. So now we are going to jump into assignment versus delegation. So let me share my screen again. All right. All right. I think, let me just double check real quick. All right. So those that did not hear, if you are in Dr. Ford's class, you I can't even talk anymore. If you're in Dr. Ford's class, you can log off of my Zoom and join Dr. Ford's group or Dr. Ford's um, Zoom. Oh my goodness. My brain. Not sure. Is it Franzia? Is that correct? I don't like, I don't like messing up people's names. No, I don't know. Okay. All right. So, all right. Oops. Still got somebody in the waiting room. All right. So again, we're going to talk now, we're going to talk about assignment versus delegation. All right. And this is going to be something that is going to be a big part of what you do. And so understanding the difference, and then of course, right, how to properly assign or delegate is going to be another thing that's going to be important for you to understand. And there's assignment and delegation is, like I said, it's going to be a big part of what you do. So it's really important to understand the difference. And then, of course, what we can delegate and what we cannot. So when we look at assignment versus delegating, assignment is the distribution of work that each staff member is responsible for a given work period. Okay. And so when we look at assigning, right, we look at some of the tasks, just specifically like a CNA, right? We know CNAs are responsible for ADL care, right? Feeding, dressing, range of motion, those kinds of things, right? So it's, assignment is just part of their daily duties. The activities are consistent with their job position and description, their legal scope of practice, their educational backgrounds. And then with assignment, this staff member assumes responsibility and is accountable for completing the assignment. Okay, so go in the morning, everybody gets their patient assignments, right? They are responsible, they're accountable for completing that assignment. When we look at delegation, this is a little bit different, okay? With delegation, you are transferring the responsibility for the performance of an activity from your one individual to another, while accountability remains by the delegator. So, for example, let's say Kizzy, let's say Kizzy, I need you to go to room 6 and get vital signs on Mr. Jones. Okay, I am delegating that task for getting the vital signs to Kizzy, but I am still ultimately responsible for the outcome. So I am, if Kizzy decides I'm not going to get those vital signs, okay, I am responsible should they not get done. Okay. The delegatee, so Kizzy has to agree to the delegation. Okay, so Kizzy, can you go get the vital signs in room, whatever I said, room 6, okay? Kizzy has to say yes. Okay, I can go get those vital signs. All right. If she says no, all right, I'm gonna ask her why she won't go get those vital signs. But the task must be accepted by the person that you are delegating to. It is a management strategy used to ensure the accomplishment of cost-effective client care, which has been shown to increase client outcomes and satisfaction. Okay, so nursing is not an individual sport. It is absolutely a team sport, right? It's going to require collaboration amongst a group of people in order to provide quality care to our clients. Okay, so it is something that is, part of what we are going to do on a daily basis. So, with that being said, where do I find information on delegation? All right. So, where do I know? How do I know who I can delegate to? All right. So, your State Nurse Practice Act, that is going to be one of the big ones. All right. So, going and understanding what your scope of practice is within your State Nurse Practice Act. It's not just knowing what your roles and responsibility is, but it's also going to be what is the what is the role and responsibility of a CNA? There's also, they may also provide some guidance for legal delegation in its regulations. Be aware that not every state allows an LPN to delegate. So it is, like I said, it is very important that you know what your Nurse Practice Act says. Delegation is not a required act. Okay, you don't have to delegate. It is not mandated. Okay, but again, like I said, nursing is a team sport, right? Sometimes you have to delegate in order to make sure that everything is done. Shankia, are you in Dr. Ford's class? You
Yes,
can log.
ma'am. Yes, ma'am.
Okay.
I was in here the whole time. I just got out for a second because my Wi-Fi went out.
No, you're good. I was just letting you know that Dr. Ford is back, so you can
Okay.
log on to hers.
Okay, thank you.
You're welcome. The state board also it may provide some guidance as well. So you can look at your state board of nursing, and that will help as well. And like I said, you should also know what the legal scope of practice is for your CNAs or your UAPs. So it's not just important that you know what your scope of practice is according to that Nurse Practice Act, but you need to know what your CNA scope of practice is as well. Other resources, rules, regulations, interpretations, guidelines, memorandums regarding delegation within your state board of nursing. You also have professional organizations that may be able to assist you as well. Okay, so NAPNES, the NON, the ANA, your NALPN, those all may help you as well. And so all of those have websites, and so you can go on there and look, as well as your organization rules and policies, right? So again, like I said, it's not just knowing what your scope of practice is, but it is understanding what your CNAs or your UAP's scope of practice is as well, to make sure that, it is appropriate for you to delegate and what tasks you are trying to delegate. And there are some rules, okay? So there are some rules, of course, for delegating. And we have the 5 rights of delegation. All right. And so your 5 rights of delegation are going to be the right task. All right. Which is always going to be one of the keys. Delegated tasks must conform to established guidelines. All right. And so again, you need to make sure that you're assigning the correct task to the right person before you decide to do that. The right circumstances. So delegated tasks don't require independent nursing judgment. We're going to go into this a little bit more as well. The right person, you need to decide who is qualified and competent. So as you're working with your CNAs, right, you're going to get to learn your CNAs, right, who are, a little bit stronger, who may need a little bit more assistance. The right direction and communication. So you're going to provide a clear explanation about the task and outcomes and when they should report back to you. And clarify a timeline and expectations, and then the right supervision and evaluation. Okay, you want to provide feedback to assess and improve the process, evaluate client outcomes. So, with all of that being said, again, really important. Right task, right circumstances, right person, right direction and communication, right supervision and evaluation. So, when we look at the right task, again, you want to make sure that they conform to established guidelines. You're going to let your laws, your policies. You're also going to assess your client, making sure that they are stable. And then, making sure that you know how what your CNAs are. So some of the specific tasks that we can assign to CNAs: personal care. So hygiene, dressing, toileting, grooming, skincare, feeding, hydration, basic restorative skills, transferring, positioning, ambulation, range of motion, vital signs, height and weight, INOs, catheter care, enemas, right? Anything to do with elimination. Safety precautions, so fall preventions, applying heat and cold, infection prevention measures, collecting urine and stool samples. So, we have to look at it, make sure that, we are being very specific. When we look at the right circumstances, all right, this is another key thing. You need to assess your patient first. All right. So your client has to be stable. All right. We are not going to delegate a task. All right. If the patient is unstable, if there's not enough equipment or there's no equipment to actually perform the task. So again, and then of course the right person, like I said, you want to make sure that you are assigning or delegating the task to a qualified person or a competent person, and then giving them the right direction and communication. All right. And this is also super, super, super important. Using effective communication, right? That is what we are going to do. We are going to provide that clear explanation of what exactly it is you want them to do. All right. So we're going to, make sure that they understand what the expectation is, what they need to bring back to us, and in what time frame. Okay, so think of this as writing a goal, right? You want to give them that clear direction as well as when they need to report back, right? So, Vanessa, Mr. Jones has an appointment at 10 a.m. this morning. So I really need Mr. Jones up, dressed, ready to go by 9 a.m. when transportation is going to be here to pick him up, right? So I expect him to be dressed or clean dress, up in a wheelchair, already had breakfast, right? I need him ready to go at 9 a.m., right? So you want to be very clear and concise. And then, like I said, supervision and evaluation. You don't want to just tell them what to do. You want to be there should something happen, should they need assistance, additional guidance, additional information. You're going to be a resource for them, and they're going to come back to you and ask questions should they need to. But you also want to make sure, like, what if Vanessa didn't have him up in the wheelchair by 9 a.m. and now transportation is here. Mr. Jones isn't ready, and now he's going to be late for his appointment, right? So there's always want to make sure that there's supervision and evaluation. So why is it important? Why do we delegate? Said, right? Nursing is not an individual sport, it is a team sport. So it does help to improve your effectiveness and efficiency as a charge nurse. Okay. It is also instrumental in realizing client goals in a cost-effective manner. And it also may help nursing assistants increase and improve their job skills, right? So we talked about empowerment, right? And so if we can help them improve their job skills, right, that empowers our nursing assistants. We also think about it too. Sometimes Some of our CNAs, they have really good work ethic. If they're really, really good at what they do, they're really good with their skills. There are additional things that they can do, right? We have what are called restorative aids. Anybody heard of a restorative aid? Okay. They you know, um, assist more with positioning and transferring, range of motion, right? Preventing pressure areas, using assistive devices. So they don't just have that huge focus on that patient ADL care, right? They have a little bit wider scope and we can provide them extra training. So there are things that we can do to empower our CNAs as well. So again, before you delegate, right, we need to assess our client, right? So you have to assess your client. You have to gather your own data because that client must be in a stable condition, right? If they are unstable, then we cannot delegate a duty. CNAs or UAPs cannot delegate. Okay, so that is another important factor to understand. And delegation cannot be transferred, right? So in that situation with Mr. Jones, and I asked Vanessa to get him ready for his appointment, right? Up and ready by 9 a.m. Vanessa can't say, oh, Natalia, I need you to go get Mr. Jones up in a wheelchair by 9 a.m. Okay, she cannot transfer that delegated duty because I specifically assigned it to Vanessa. Now, Vanessa can refuse. Sorry, Vanessa, you were just the first name that popped up. Sorry. But Vanessa she can refuse the delegation. She absolutely can say, no, I don't want to do that. Right. And then, of course, we're going to ask why. All right. So, why do you not want to perform that? All right. And when we look at that, again, like I said, they have the right to deny. We want to ask them why. All right. And when we delegate the duties and they refuse the delegation, we want to know why. Reason, because it could be a combination, right? Excuse me. So maybe Vanessa has never done this task before, okay, and she's really not sure how to do it, right? That means then we may, need to provide some education, which is great, right? Because it's about empowering. I'm going to teach you something new today, all right? Or it could be, I just don't want to do it, right? Which is a little bit more of maybe an attitude problem, right? Or an issue with that. So we have to, like I said, we have to make sure that we are, understanding what the problem is or what the issue is. And like I said, it is okay to refuse. Again, we want to determine between whether it's I just don't want to do it or if they need additional training.
What about
Okay.
delegation between RN and LPN?
I'm sorry, say that one more
What
time.
about delegation between the RN and the LPN? Is that the same thing for LPNs with RN delegation?
Absolutely. Absolutely. And so refusing assignments, like I said, if you, but be prepared to offer an explanation as to why you don't want to do something, right? Because like I said, there is a difference between I don't want to do something and I don't know how to do something, right? One, like I said, could be an attitude problem. The other one could be a training issue, right? And so there's going to be different ways to handle that situation, right? If it's a training issue because you don't know how to do something or you're uncomfortable doing something, right? Then we want to provide that education to you. One, so for what? I'm so sorry. For one, that's going to empower you. It's going to provide you with information and additional training so you can perform skills better. Okay. The other one, we need to kind of figure out, is it because I'm sorry. While I was reading and I lost my chain of thought. I can't multitask all of a sudden. Um, but yeah, we want to know why they don't want to take the task. So RNs can delegate to everybody, yes. So RNs can delegate to LPNs and to UAPs. LPNs, if it's in your state nurse practice act, then you can delegate to UAPs. You may at times also, they have to, I wonder, to look at your Nurse Practice Act because this is a question I just thought about. Depending, I guess, on your position, you may be able to delegate to another LPN as well. Okay, so you have to look at your Nurse Practice Act because, like, if I'm an LPN charge nurse and I have an LPN who is maybe a med nurse on, well, yeah, if I'm, because now that I think about it, I just answered my own question. So with that example, so when I worked when one of my first jobs as an LPN, I was a team leader on a skilled care unit. So I was the team lead. I had a med nurse, who was also an LPN, and I had CNAs. And so I would delegate not only to my CNAs, but to my med nurse as well. So depending on your position, you may even delegate to another LPN. You always want to use your nursing process when you are delegating, right? That is always going to be key. You also, in times where you may not be 100% sure, or you want to, have somebody else, you can always collaborate with your RN, right? Collaboration with the RN as far as delegation is always going to be a safe bet for you as well. When we look at some of the legal aspects, all right. So, of course, there's going to be legal aspects. One of the biggest ones, I've said this, delegate only if allowed by your state's Nurse Practice Act and your facility policies. So this is what I said. Remember, not in every state allows LPNs to delegate. So you need to look at your Nurse Practice Act to make sure that it is within your scope of practice to delegate duties and your facility policies. You also want to make sure that your client's condition, we only are going to delegate tasks to a stable patient. The patient is unstable. We are not going to delegate that task. Delegate duties for which nursing assistants have demonstrated abilities. And again, you are going to learn your CNAs as you work with them. You're going to know who is, some of your stronger ones, maybe some of your weaker ones, but you are going to learn your CNAs, what their capabilities are. Okay, so you want to pick the appropriate CNA for that a specific task. You're going to provide specific, objective, clear-cut directions for those delegated duties. And then, of course, you want to provide assistance and instruction to nursing assistants when you delegate a duty. Okay, you don't just pass the buck and say, go do this. You want to make sure that you are providing assistance, instructions, if they need additional information, that they can come back to you and ask questions. You're also going to monitor the activities of nursing assistants when they carry out those delegated duties. Remember, if you delegate a duty, okay, you are still responsible for that duty to make sure that it is, that it gets done. And so depending on your nursing assistants and the situation, the monitoring can mean anything from being right there or a periodic check. If needed, you're going to intervene to maintain safety. On completion of the delegated duty, you want to evaluate the safety and effectiveness of the duties delegated to nursing assistants. So once they perform the delegated task, you're going back and you are going to evaluate your patient. And you are going to evaluate the task. Was it done appropriately, correctly? Were you provided with the appropriate feedback? Excuse me. This is where it comes in. This is where it's going to come into a tricky situation. If you delegated improperly and our resident was harmed, you are going to be liable. Okay. And that can result in disciplinary action against your license or even a civil suit. And I'm going to just throw this out there. This is a wild card. Okay. This is never going to happen. But let's say you decide you're really busy and you have a CNA that is really good. Maybe she's even in nursing school and you're like, hey, Mr. Jones needs this IV hung. Can you go hang this IV bag? Right? We're never going to delegate that to a CNA, but let's say you did. All right. If a resident is harmed because that CNA hung that IV, because you are the one that delegated that task, you are going to be liable. Okay. Because that was not a proper delegated duty. Now, if you delegated properly and you included monitoring and the client, then you as well as the nursing assistant would be, you would both be liable in that situation. So let's say, all right, let's say you asked the CNA to go get on glucose. Okay. And they went in, they did their finger stick, they got their glucose, and, maybe their glucose level was fine, but then they got an infection in their finger, which ended up getting their finger amputated. Okay. Not that I hope that would never happen. I've never seen it happen, but let's just say, okay, the client was injured, then both of you would potentially be liable in that situation. So again, have to be careful with what you're delegating, who you're delegating to. Always want to provide effective, make sure you're communicating effectively and you're following up. Delegation should always occur with a collaboration with an RN. So again, always, you have your RN available. You can always go with them and, discuss the situation. And then according to the American Nurses Association, the NCSBN, which is the National Council of State Boards of Nursing, the RN also should follow the 5 rights of delegation: right task, right circumstances, right person, right direction and communication, of course, right supervision and evaluation. So what can we assign or what can we delegate to a non-licensed or an unlicensed assisted personnel or a CNA? So personal care, again, I said this, but we're going to go through it again. Personal care, including hygiene, dressing, toileting, grooming, and skincare. Feeding and hydration, basic restorative skills, including transfer, positioning, ambulation, range of motion. Vital signs, height, weight, INOs, assistance with elimination, including catheter care, maintaining safety factors, including fall prevention, application of heat and cold, and infection prevention, and collecting stool and urine specimens. What can we not delegate to a CNA or a UAP? Complex sterile procedures, okay? Nursing assistants do not have in-depth training in sterile technique, okay? They're not going to put a Foley catheter in, in for you. They're not going to do a dressing change, okay? Nothing, no sterile procedures. Also, we're not going to delegate in a crisis situation, right? So again, it's your job to make sure that you go assess your patient and make sure that they are stable before you delegate a duty. Initial education by an RN is never delegated, right? RN cannot delegate that to an LPN because why? That initial education needs to be done by the RN. LPNs can reinforce the initial teaching. So RN goes in and provides education about how to use an incentives barometer. Okay. They provide that initial education. Now, when you go in to see that client, right? Have you used your incentives barometer? Let me see you use your incentives barometer. Remember how to hold it, right? You can reinforce that teaching. Although nursing assistants can collect simple data, they have not been trained to make decisions about or interpret those data. Okay, even that nursing assistant that is in nursing school, okay, that is, they are not acting as a nurse or nursing student if they are working as a CNA. Okay, so they have not been trained to make those decisions about or interpret data. So, for example, nursing assistants cannot evaluate the results of a glucose or determine when vital signs need to be rechecked, right? So they are simply performing the task. They are going to bring that information back to the nurse, and then the nurse is going to act on the information that was provided to them. When delegating to a UAP, the delegated responsibility must be within their authorized scope of practice under the Nurse Practice Act. So that's like I was saying, right? If we inappropriate delegate by, having that CNA who's a nursing student as well hang that IV bag, right? That is not within that CNA's scope of practice. So that is why I said it is super important for you to know what the scope of practice is, not only for yourself, but of your UAPs as well. All right. So with all of that, any questions on assignment or delegation? Because once we finish this lecture, we are going to do some practice questions. So any questions? Everybody's good? Kind of, sort of. All right. We'll come back to it. All right, so other things. We look at LPNs and our as a first line leader, right? So charge nurse. So as a charge nurse, you're going to supervise nursing assistants. You will also develop your leadership and management skills and that process of supervising your nursing assistants. You should know what your organization's mission statement is. And so a mission statement, every organization has a mission statement, even Fortis has a mission statement. All right. And so that mission statement defines the purpose and the goals of the organization. All right. And so some, may even have it like plastered on their walls. Okay. But again, it's their purpose, goals, it states their values, their culture, their norms. All right. And so the LPN, as that wonderful charge nurse, is going to work towards the vision, leads team members in fulfilling and commitment to the mission. So again, really important that you know what your organization's mission statement is. And then again, can't say it enough. I feel like I feel like I just should put it on repeat. Make sure you know what your Nurse Practice Act is, right? Your roles and your boundaries. So think of that Nurse Practice Act as an umbrella. Okay. So that's at that wonderful state level. All right. That's your umbrella. These are all the things that you can do under your Nurse Practice Act. Your organization. Okay. Now, your organization may limit what you can do, but it can't go beyond that umbrella. Okay, so it can't expand your role. So, for example, okay, most states, and I'm pretty sure it's all states, that LPNs cannot do IV push medications, right? You can hang IVs, you can put them on a pump, you can put them on dial-a-flow, right? But you can't IV push, right? A medication. That's your Nurse Practice Act. So your organization can say, oh, yeah, it's okay for you to push that medication, right? They can't do that. They can't violate that Nurse Practice Act. They can limit your practice, though. They may say, oh, well, we've decided that LPNs don't do IV medications here. Okay. So they can't go beyond that umbrella, but they can limit what you do. And that's not just for LPNs, that's for RNs, it's for CNAs, it's for everybody. Right. So just for example, with CNAs, um, like one of the organizations that I used to work for, even though CNAs are trained to do vital signs, our organization didn't allow CNAs to do vital signs. So I could never delegate a task like that to a CNA because it was against our policy and procedures. Other states, CNAs can do tube feedings, right? So it depends on your individual state, what that scope of practice is. That's why it's so important to know what that is. Usually for a charge nurse, okay, it does require you have at least 1 year of experience. Again, that's going to be determined by the organization that you work for. You need to have a current license in your state of practice. And some of the standards within that, charge nurse position, can't even talk, collaboration, you will assist the DON in new employee orientation, and you will be responsible for evaluating CNA performance. Okay, so you will do performance evaluations on your CNAs. Other parts of the charge nurse job description, all right. Assess and evaluate residents. You will need to know what their condition is at all times. You will assign tasks to your nursing assistants. You will provide care within your scope of practice by policy and under physician orders. You will assist the physician with therapeutic and other procedures. So like, for example, one of the places that I used to work at, we didn't have a wound care nurse. So the charge nurse would follow the wound care physician around when they did rounds. So that would require them assisting with things like, debridements and wound care. You need to be able to recognize symptoms of pending adverse developments and report those back, either to the provider or the RN, depending on how your organization is set up. You will need to administer medications and treatments. Of course, documentation, making sure that you have proper documentation is going to be key. You will delegate tasks. You will make sure that there is a safe environment for your residents as well as your team. You maintain patient privacy as well as dignity for your patients. Other things that you need to know in order to be in charge. Personnel policies. So employee manual, timesheets, payroll policies, right? How do I request a day off? Communication and reporting. So reporting is a little bit different in long-term care, and then of course it's going to depend on the organization that you work for. But right, adverse patient events, like for example, most of them, it's usually the DON that will then report. In cases of abuse, we would have an abuse coordinator, which is either going to be the administrator or the DON. Break rules, smoking policy, personal device use policy, proper uniform, right? So some organizations are color coded as to what color uniforms or scrubs you need to wear, right? Again, you need to know what those policies are. Personal device policy, be very careful with using your cell phones. Um, there has so many people, you see it all the time, right? Nurses are getting in trouble for using their cell phones. Whether it's, taking pictures and posting it on social media and patients are in the pictures or making fun of patients. Um, be very careful with your cell phone use. Just, know what your policies are. Know that if you have your cell phone at work and something happens, then they can go through your cell phone. All right. So be very mindful of that. You'll also need to know what the routines for each of the shifts. Most shifts like have a to-do list, right, of general functions that need to be done on that particular shift. Procedure manuals, special procedures, nursing care plans, Pyxis and Cardiac systems. So long-term care generally don't have Pyxis. Okay, we usually have those big Cadillac med carts that we push around. They may have a Pyxis or an Omnicell or some other, small one where we keep emergency medications, backup medications, those kinds of things. Charge nurses are responsible to sometimes to go to care plan meetings, clinical references. So I always thought it was really interesting. So that big skills book that you guys got, like that has all your like nursing skills and stuff that you do throughout your program. That is actually a book that is used by a lot of facilities, right? So let's say, you forget how to do a skill, well, just pull that book out and you can look up the skill to see how to do it. Other things, we look at administration, unit administration, how to admit, how to discharge, how to transfer a client, the inventory, valuable inventory. This is super important that you do on admission. You take an inventory of all of their belongings and you list it out. What to do if somebody declining or becomes seriously ill, death procedures, forms, authorizations, visiting hours. You also need to know side rails, chair alarms, bed alarms, restraints, the O2 system, patient transport, door alarms, standard precautions, of course, the security and the smoking policies. This is a big difference in long-term care. We don't have side rails, we don't use bed and chair alarms, and we don't use restraints. Okay. You may see in some long-term cares, they have like the 1/4 inch rails that they can use for positioning, but we do not use full side rails. And actually, I'm gonna go back, circle back on that. Um, Hospice patients. So hospice patients are a little bit different. I have When hospice does bring equipment in, they sometimes will have full bed rails. But generally speaking, we do not use bed rails. Oxygen suction equipment, specialty beds. So all of the beds in long-term care are pressure reducing mattresses, but you also may have come across like those low air loss mattresses. So making sure that you know how to use those, how to use the suction machine, where's the oxygen. In long-term care, some facilities will have oxygen built into the walls. Most of the ones that I've worked in, we've used oxygen concentrators. You'll also need to know how to order food from dietary. So, new patient comes in and you have a diet order, or we have a diet change. You need to know that process. What food stock is on the unit, snacks, that kind of thing. The different diets that are available, what the feeding policy is. So, generally speaking, feeding policies. If you have roommates, one's a feeder and one's not a feeder, they have to eat at the same time if they're eating in their room. Otherwise, it's a dignity issue. What's the process for dining room, right? What's the process if a family comes in and they want to order a tray from the dining room to eat with their loved one? How do I do that? And then all the other stuff, right? ADLs, bathing, showering, oral care, bed making, vital signs, catheterizations, enemas, suppositories, INOs, specimen collection, colostomy care, glucose monitoring, NG and G tubes, postmortem care, standard precautions, how to use all the equipment, how to order medications, what to do in the event of a medication error, how to perform the narcotic counts, what are the documentation requirements, are there special forms, flow sheets, right? How do we do physician orders, incident reports, special lists like for wanderers, hearing aids, dentures, all of those wonderful things. Let's see. And then, oops, I know I missed this. All right, collecting data. So we know collecting data is part of your assessment process. All right, so when we're collecting data, some of the key things that we want to look at, their sleep and their rest, mobility and exercise, hygiene, communication, right? Cultural, social, or cultural, religious, sensory, perceptual, psychological. So we're making sure that we're collecting data appropriately. And depending on where you work in that documentation, it may be like like a checklist, or you may have to actually write out certain things. Um, Other things with charge nurse responsibilities, and this is a big one. Um, Encouraging responsibility. So I said that you're going to be supervising and working with UAPs. Um, and even like I said, sometimes with new nurses that may be a little bit more shy or unsure of themselves. And if you've been working for a while or you're really good with your skills, you want to be that role model for somebody. Okay. I always use the see one, do one, teach one approach when I'm teaching skills. Okay. So I'm going to show you how to do it. I should not show you, you're going to watch me do it. Then the next time you're going to do it and I'm going to watch, and that teach one is you're going to teach somebody else how to do it. Not only that is it helps to reinforce it in your head. Um, Always reinforce if they do a good job. If they need, additional training, of course, you want to provide that as well. But again, this is about empowerment, right? We're teaching somebody to do something that is new to them, and we want to provide that ability. We want to be supportive, provide that education, and then, continue to allow them to grow. Oops. And then last little bit of this, employee home problems. All right. So we talked, we know that coming into work, right? We try to say, leave it at the door, right? Leave your problems at the door because, you're here to do a job. You're here to, help help those clients. Um, but everybody has issues that can occur outside of work. Okay. And so biggest thing that we want to do is be supportive. All right. So when people come to you and they have, issues outside of your work, obviously we are sometimes going to be a supportive person for them. So you will provide support. You can demonstrate empathy, not sympathy, but you don't want to fall into that monkey trap. You do not want to counsel them. You don't want to own the problem. Our goal is to help them to help themselves. Okay. We may even offer them some other resources, like the employee assistance programs or something like that. Okay. You do not want to own the problem. You want to assist them in helping themselves. In certain cases, you may have to escalate it to other departments. And so that is part of that process. And then the last part of this is dealing with those difficult families. And so working with families, can be difficult. There is a lot of reasons why families get upset. Some of them are real, and then some of them may even be perceived by them. And I'm going to stop sharing, working with, families that may be a little bit more difficult. It can be a challenge. And there's lots of reasons why this occurs. Some of it could be guilt because, hey, I've had to put my loved one in a nursing home or a long-term care facility. And I feel guilty because I'm not able to care for them, by myself at home. If they are dementia patients, right, that dementia is hardest on the family. It's not as hard on the client or the patient. It's hardest on the family, right? Because that person is in their world. They're living in their own world. They're not, unless they have another disease process going on, they're not in pain, they're not hurting, they're not suffering, right? And that's hardest on the family because they don't recognize us anymore. They don't know who we are, right? We're trying to, keep them in the present, but they're not here with us anymore, right? They're in their world. And that's really hard. That's hard on anybody. And that sometimes can even add to the guilt about leaving their family members in a long-term care, when they're not there. And they may complain about the food. They may complain about, the bed not being made, or, oh my gosh, they haven't had a shower in 2 days, right? So they may pick up on these little things and make them, blow them up into something that's even more. How do we respond to that? And this can be difficult, all right, but you want to still build a nice, sincere relationship with these family members. Allow them to express their feelings, their frustration, sometimes even their anger. If there's been a mistake, apologize for the mistake. Don't make excuses. Don't say, oh, well, we were understaffed. No, just apologize. I apologize that this wasn't done correctly. We will move forward. We will make sure that it is done appropriately, right? Apologize for mistakes. Don't make excuses. Be clear on how to fix the situation, and then give them your time. And this is something that's often something hard to do only because we don't always have a lot of time, right? But we need to give them the time to discuss the situation, to get their concerns out, and develop that rapport with them. And like I said, I know sometimes that can be difficult, but you want to always try to do your best to build that rapport, provide as much education to them about disease processes and what's going on. And if they don't understand, continue to clarify and provide education. Um, Suggest support groups, especially for dementia, Alzheimer's. Suggest those community support groups. That really does help. It helps them to listen to other stories, right? It helps them to understand the disease process, and it also gives them a chance to discuss or talk about their feelings, right, in a group of people that understand, right, a little bit better about what's going on. Biggest thing is though, don't ever just make sure that we're allowing for them to continuously stay involved with their loved one's care. This is a really big one. We don't ever want that loved one to feel disconnected, or we don't want the loved ones or the family to feel disconnected, right? We want them to still be welcome to come in, visit with their loved ones, and maintain that connection. It may look a little bit different, right? So we have to, take that into consideration that it may look a little bit different, but we still want them to come in and, have that relationship with their family member. All right. So we are going to take a break. We're going to be back at 7:40, and then we're going to do some practice questions. All right. So I'm bringing up some questions. So we're going to start with 15. If we get through them, then we will do some more. One second. All right. There we go. All right. So everybody needs to respond. Okay. You can respond in the chat or you can respond out loud, however you want to do it, as fine with me. Let me just open my chat a little bit more so that I can see all of the responses. All right. I'll share my screen. So again, these are about delegation. Okay. So there's no assignment in these. This is going to be strictly delegation. All right, so number one, we have for a patient with a tracheostomy, which duties can the nurse safely delegate to assistive personnel? This is a select all that apply. So one, hold the tracheostomy tube when the nurse is changing the ties and tube holder. Two, instructing the patient on how to cough effectively to remove secretions. Three, gather tracheostomy sterile supply kits prior to the dressing change. 4, checking the tracheostomy cuff pressure with a manometer. 5, assisting the nurse in delivering oxygen before and during sterile suctioning. Or 6, auscultating the lungs before and after suctioning the tracheostomy tube.
1 and 3.
Yeah.
All right, we got 1 and 3
1 and 3.
and 5.
Five.
Brenda.
And
5.
5. Yeah.
All right, so 1, 3, and 5. All right, so I'm going to hit submit. Good job. Absolutely. So they can hold the tube when the nurse is changing the ties and tube holder. They can gather the tracheostomy sterile supply kit, right? You can send them to the stock room. Hey, can you go give me a trach kit? And they can assist the nurse in delivering oxygen before and during sterile suctioning, right? So by helping them deliver the oxygen, right, that helps the nurse to remain sterile during the procedure. Very good. All right. Another one. I love this question. So the charge nurse has delegated reading the labs of a patient with COPD. Okay, we got COPD to a float nurse. Okay, the patient has the following ABGs. We have a pH of 7.35. We have a CO2 of 48. We have an O2, that's a typo, of 80. We have a bicarb of 28. The float nurse is unsure if he should take any further action based on the ABGs. Which course of action should the charge nurse suggest? So, are we going to suction the patient?
No.
Are we going to increase the oxygen to 3 liters per minute? Notify respiratory therapy for a PRN breathing treatment? Or are we going to just continue monitoring the patient?
I would
So,
increase oxygen.
okay.
3.
2.
We got 3, we got 2, and we have a 4. We got 2 4s, a 1, and a 3. So
Yeah.
What about
let's
3?
break this question down. And then I got a 2 or a 4. Okay, that's all right to be unsure. That's why we're going to work through these. So what's our diagnosis?
COPD.
COPD.
Tell me about COPD.
The O2 can be between 89 and 92.
Okay, O2 can be between 89 and 92.
Patient depend on oxygen to breathe.
Okay, they need oxygen to breathe. What else about
You
Tanasia?
can't give them too much oxygen.
We can give them too much oxygen. Tanasia, Miss or Dr. Ford's Zoom, she's back on Zoom. She's back on her Zoom, I mean. I don't know how that came out. Can you hear me? Tanasia, can you hear me? You can go back on Dr. Ford's Zoom. They can't use a lot of oxygen, absolutely, right? So we're not going to increase our oxygen to 3 liters per minute. Because what could happen? What could happen if we have a patient with COPD and we give them too much oxygen?
Overload of oxygen.
They
Overload.
can stop breathing because that will
They're
allow
not
them.
used to it.
Right. We can suppress their respiratory drive, right? Because patients with COPD are used to, right, those higher levels of CO2. Okay. So we're not going to increase the oxygen. All right. So that leaves us with suction, respiratory, or continue to monitor.
I think continue to monitor.
Okay. So you are a tiebreaker. So we're going to continue, we're going to hit that. Absolutely. Right. AB normal ABGs, right? 7.35 to 7.45. Normal CO2, right, is 35 to 45. Normal O2 is 80 to 100. And then normal bicarb, right, is your 22 to 26. So yes, pH is right there at the bottom. PaCO2 is a little bit high, right? And then our bicarb is a little bit high as well. So a patient with COPD normally retains carbon dioxide. So it is expected that their CO2, right, may be a little bit higher. And that's going to cause them to be a little bit more acidic, right? Because they're retaining more CO2, more acid. The bicarb is going to be higher, right? Because it's compensating for that pH to drop, right? So this is a normal finding for COPD. So you're absolutely correct. We are going to continue to monitor this patient. Very good. All right. The nurse has delegated all the personal care of her patients to the assisted personnel. Which of the following situations would warrant the nurse to give additional guidance to the assisted personnel? So, one, we have a patient with COPD who is reclining in a chair at a 120-degree angle. Two, we have a patient with tuberculosis in a negative pressure room with the door closed. Three, we have a patient on a clear liquid diet who is eating a popsicle. And four, we have a patient with viral pneumonia being transported to X-ray with a surgical mask on. So which one of these would require the nurse to give that assisted personnel additional guidance?
For sure wouldn't be 2 and 4, so we are left with 1 and 3.
All right. We're left with 1 and 3.
I say one.
You say 1.
I mean,
Who says 1? Raise your hand if you say 1.
I say 1 too.
All right. Let's go with 1. Da-da-da. Absolutely. Okay. Clear liquid diet, popsicles are okay. Right? They're going to melt into a liquid. Usually that is fine. So a patient with COPD should be placed in a Fowler's position, right? Sitting upright or leaning forward to help with breathing. Elbows may be placed either on the patient's knees or with their arms folded and placed on a nightstand with a couple pillows on top. That helps them to breathe, right? Patients with COPD usually have orthopnea, right? Which is that shortness of breath when they're laying down. So we put them up in an upright position. I have seen patients with COPD literally with pillows on their bedside table, literally sleeping like this, okay? Because it just helps them to breathe a little bit better. All right, here we go. Now we have a post-op patient that has had a tonsillectomy. Vital signs upon return to the unit were temperature 90 or 98.7, pulse 76, respirations 20, blood pressure 134 over 72, and O2 sats at 98% on 2 liters of oxygen. They have remained stable for the past hour. Which post-operative duty should not be delegated to the AP? 1, check vital signs every 30 minutes for 2 hours. 2, position the patient in a semi-Fowler's position. 3, assess the patient for frequent swallowing, sorry. Or 4, place an ice pack around the neck.
3.
Very good.
3.
Why?
Yeah, 3.
Because they
Or
cannot
safe. They can't
assess.
assess.
Awesome job. Good job. All right, number 5. The nurse and an assisted personnel are assigned to a patient on mechanical ventilation. Which action should the nurse delegate to the AP? 1, assessing the need to suction the endotracheal tube. 2, assisting the respiratory therapist with obtaining an ABG. 3, evaluating the response to medication. Or 4, cleansing and reapplying a transparent dressing to a stage 1 pressure injury.
I'm gonna say 2.
2. 2.
All right.
Mm.
2. All right. We'll go with 2. Absolutely. Can assess, right? They cannot assess, they cannot evaluate. And applying a transparent dressing, they really shouldn't do. The nurse really needs to look at that wound, right? And notice if there's any changes. But yes, they can absolutely assist with getting ABGs. All right. The nurse is caring for a post-op patient who underwent surgery for placement of a porcine valve. Which instructions should the nurse give to the assisted personnel regarding the post-op care of the patient? Select all that apply. So 1, use a soft toothbrush when providing oral care twice a day. 2, chart intake and output. 3, observe for and report obvious blood on the surface of the dressing. 4, report any complaints of chest pain or discomfort. 5, apply oxygen via nasal cannula at 2 liters per minute. Or 6, remind the patient to cough and deep breathe every 2 hours.
1 and 2
1,
for
4,
sure.
6,
3, 4, and
6,
All right, so we got 1 and 2. We got 3, 4,
4,
and
And
6. Is that
6.
what somebody said? Okay. All right, let's see. All right, awesome job. Yes, absolutely. What's a porcine valve?
what?
Pork valve.
Right, it's a pig valve, right? So they've had a heart valve replacement and we've put a pig valve in there, okay? So very good. We're going to use a soft toothbrush when providing oral care. Why?
For bleeding.
Bleeding, right? Because they're going to be on a blood thinner, right? If they've got a new valve replacement, they can definitely do I&Os. They can observe, right? If they notice bleeding, they can come and tell somebody. That doesn't require assessment, right? It just requires them looking at the dressing. They can report any complaints of chest pain. And of course, they can remind the patient to cough and deep breathe, right? They're not teaching them. They're just like, hey, did you do your deep breathing and coughing, right? That is all they're doing. Very good. All right. Which instruction would the nurse give to the AP about caring for a patient who has altered mental status during the post-ictal phase of a grand mal seizure? 1, stay with the patient until he is alert and able to recall events. 2, assist the patient to a side-lying position and encourage rest. 3, arouse the patient every 15 to 20 minutes and give sips of fluid. Or 4, observe, report, and document the return to baseline behavior. So we have,
Is it
go ahead.
2?
4.
I got 2 and I got a 4. I need a tiebreaker. So I got 2 2s and a 4. 3 2s
4.
and got another 4.
2.
Another 2. All right, we'll go with 2. Yes. So now here's the thing. What is the post-ictal? What does post-ictal mean?
After?
After the seizure.
Seizure.
Yeah,
All
after the seizure.
confusion.
Right. It's the time frame after a seizure. Most people are going to be really sleepy, right? They don't want to be bothered and they need to rest. Okay. So we can they can help them, put them in a side lying position and encourage rest. We don't want to wake them up every 15 to 20 minutes, right? They can't observe, report, and document return to baseline behavior, right? That's a nurse's job. Stay with the patient until they are alert and able to recall events. Sometimes with a seizure, they may never remember what happened during that seizure, right? So poor CNA might be sitting in there for years, okay? So we don't need to sit with them and wait until they are alert and able to recall events. All right, I love this question too. The patient has a Glasgow Coma Scale score of 8. Which instruction would the nurse give to the assistive personnel? 1, encourage the patient to independently do as much self-care as possible. 2, remind the patient to use the call bell whenever assistance is needed. 3, identify yourself and explain everything that you are doing as you do it. Or 4, raise the head of the bed before feeding the patient or giving fluids.
That's a normal score, right?
Or
I was just going to ask you.
Yeah.
So, what is a normal score for GCS?
Yeah, 8 is a normal score. Is that?
I think 8 and above.
Oh.
No. Mm.
Let's see. Let me get the Googles for you. Gotta love the Google, right? All right. So I'm going to stop sharing this screen and I'll pull up this one. Oh, of course, that one's not going to let me. Let's find another one.
It says 8 indicates a severe brain injury or coma.
I
Yeah.
was gonna say that the lowest the numbers, the better the patients,
All
right?
right. I'm going to share. Hold on. I'm going to share my screen. Go back to the screen. All right. So here is your GCS. And I couldn't pull up the document that I wanted to. So we're just going to go with this one. Okay. So GCS, the highest score is 15. All right. So a high score of 15 is right. That's the best. That's alert oriented, happy, and all that stuff. Right. So that would be eyes open spontaneously, which is 4, obeys command, which is +6 is 10, and then oriented is 15. All right. The lower we go, right, the more in danger that they are. So yes, I'm going to stop sharing. A GCS score of 8 means that they probably have had some sort of severe head injury and they are comatose. All right. So whoops, let me go back to the other screen now. So which one of these, if my patient is comatose, would be appropriate for me to tell the assistive personnel?
3.
I was
Very good. Yep. Why? Because hearing is always the last sense to go, right? Okay. And so think about it. And I don't know if anybody is, but you hear stories, right, about people waking up from comas, right? And they remember, they've heard everything that has gone around them, but they haven't been able to respond. So we always, doesn't matter if your patient is alert or oriented or in a coma, we never just go start doing stuff, right? We still talk to them. We still tell them what we are doing to them.
And what was the answer for 3? Because I can't see it. What was it?
It is 3. Identify yourself. Oh, I'm sorry. Identify yourself and explain everything you are doing as you do it.
Okay.
All right. In caring for an unconscious patient now, which instruction would we give to the AP about positioning the patient? So we're unconscious. 1, put them in a lateral recumbent position. 2, place the patient prone with head turned to the side. 3, place the patient supine, align the head and the neck. Or 4, put the patient in a high Fowler's with side rails up.
4.
3. 3.
We got a 3 and we got a 4 and a 2. All right. So we have an unconscious patient. What is prone?
Face down.
Face down. Okay. So are we going to put an unconscious patient face down?
no.
No. So lateral recumbent. What's lateral recumbent? I can't even say it. Lateral recumbent.
That's like for an exam, right?
With the legs up. That's what the like you getting a pap smear.
Yeah. No.
No, that was good though. Lateral recumbent. I know it's a big fancy word for this for a sideline position. That's
With the
your
pillows or
recovery.
something?
That's your recovery position.
Mm.
Yep. So prone is face down. Lateral recumbent is on the side. Supine we know is laying on their back, right? Head and neck aligned. And then high Fowler's is sitting straight up with the side rails up. So unconscious. What are we going to do? We got
4.
3. We got 1. We got 3. All right. I need tiebreakers here.
3.
We got 3.
4.
Let's go. We got 3. Too many. All right. So the correct is going to be that lateral recumbent. So lateral recumbent, that's used to prevent aspiration. Okay. So just like we put a patient that's just had a seizure in that recovery position, okay, we're going to put that unconscious person in that recumbent position as well, right? Because they probably aren't going to be able to swallow their secretions, right? So it helps to prevent aspiration. All right. You guys are doing great, though. I am really proud of y'all. You're doing awesome. All right. Which actions can the nurse safely delegate to an assistive personnel when caring for a patient at risk for pressure injury? Select all that apply. So 1, turn and reposition every 1 to 2 hours. 2, check and record vitals every 4 hours. Almost said 2. 3, assess pressure points for redness and blanching. 4, assist the patient to the bathroom as needed. 5, remind the patient to sit up in a chair 3 times a day. Or 6, administer the patient's daily vitamin supplement.
I say
So,
1,
1,
2,
3.
2,
No, 1,
3,
2, and
no, 1, 2, and
2,
4.
1, 3, and
2,
4.
4.
no,
I
they
say
didn't do
1,
3.
2,
1, 3,
4,
I
4,
got one,
5.
two,
5,
3,
four,
and
and
1, 2,
4.
1,
5.
2,
4,
4, and
5.
5.
One,
all
Yeah,
right. 1,
not
2,
3.
What
right.
does 2 have to do with pressure injury?
What?
I don't know.
Who
1,
said
2,
that?
3, 5.
Who said
I
that?
mean,
I was
that is.
I was asking about I forgot I was on speaker, but
no,
what
go
does
ahead.
vital signs got to do with pressure injury?
What does vital signs have to do with pressure injury? Does it have anything to do with pressure
I
injury?
say 3.
I say 3
What's
too.
the
But
key
they
word
can't
in here?
assess. I thought they couldn't assess.
What's the key word, right?
Assess.
Assess. Can
Mm.
CNAs or assisted personnel assess?
No.
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 No. All right, I'll leave it like this. Very good. So, basic care, assistance with ADLs, as well as checking, recording vital signs, reminding or encouraging patients about information already taught by
So
the
no,
nurse.
they don't give medication unless it goes to.
So
So
what
they
do
can,
vital signs have to do with it? I mean, I know they can take vital signs, but what they got to do with anything?
somebody's got some echoes going on. So vital signs help us to assess perfusion, right? So, right, if our blood pressure is low, right, we may not be perfusing the tips of our toes and the tips of our fingers, right? So helps to assess perfusion, right? Know that we are getting blood flow to all the necessary areas. But it is something that is within their scope of
Oh.
practice.
I
All
can't.
right. Which instruction will the nurse provide an assistive personnel for providing skin care on a patient at risk for a pressure injury due to immobility and incontinence? So 1, using an antibiotic soap with hot water to wash the skin. 2, vigorously scrub the skin to promote perfusion. 3, apply powder after cleansing the affected area. Or 4, cleanse the skin gently and
4.
apply a
4.
moisturizing.
4.
4.
4.
We have a
4.
consensus. I love it. Yes, absolutely. Right. Well, we can use an antibiotic soap, right? That's not a problem. But do we want to use hot water? Right? Because that's just going to dry out their skin. We don't want to scrub the skin. That's not going to promote perfusion, especially in a patient that has a pressure area or a risk for pressure area. And we don't apply powder. So good job. All right. The nurse is assisting with the admission of a patient from a long-term care facility who has a stage 4 pressure injury wound. Which actions or interventions will the nurse delegate to the experienced assistive personnel? Select all that apply. 1, help move the patient from the stretcher to the bed. 2, orient the patient to unit policies. 3, take the patient's temperature. 4, assist the patient in changing into a hospital gown. 5, assess the patient's wound. 6, check the patient's oxygen saturation.
1 through
So,
4.
4,
4,
3,
3,
6.
I got a
6,
1
and 1. Yeah.
and a 6. Let's see. Good job. Absolutely. Help move them from the stretcher to the bed. We can take their temperature. We can change them into a hospital gown, and we can check their O2 sats. We cannot assess and we cannot orient, right? The nurse should be the one that provides that orientation. All right. A family member has been caring for an older relative with dementia for a long time. Which action related to caregiver burnout could be delegated to the home health aide? So 1, observe the quality of interaction and caring between the caregiver and the person who has dementia. 2, inform family members the home health agency is holding a seminar for family caregivers next month. 3, suggest strategies that can help the primary caregiver to maintain own health and emotional well-being, or role model care and attention towards the person with dementia to decrease caregiver guilt and burnout. This is a good question.
4,
4,
maybe.
3.
maybe.
3, maybe. Yeah.
Maybe.
3, I
3,
think.
maybe.
I'm thinking 3.
Mm.
So I got 3 and I got 4.
3.
Another 3. Anybody else? Got lots of 3s. Well, another 3. All right, we're going to go with 3. Here we go. Dun, dun, dun. So the correct answer is inform family members the home health agency is holding a seminar for family caregivers next month. So the nurse can instruct the home health aide to give the date, time, and location of programs that may be of interest to family members and patients. The home health aide would not be expected to explain the benefit or subject matter of the programs. Observing family dynamics, suggesting strategies, and role modeling are nursing responsibilities that should not be delegated to the AP. So they can tell them, hey, the home health agency is holding a seminar for family caregivers next month. Here's the date, here's the time, location, all that good stuff. All right. Which instruction would the nurse give to the AP for a patient with sundowner syndrome? Everybody knows what sundowning is?
Mm-hmm.
All right. So 1, help the patient to do complex tasks such as filling out a menu in the morning. 2, help the patient to perform bedtime rituals and get into bed before sundown. 3, encourage the patient to take a nap between lunch and dinner. Or 4, assist the patient with attending a fun and interactive social event after dinner.
Would it be 2?
2.
2. Would it be 2?
So sundowning. So somebody asked what sundowning is. So sundowning, how do I explain this? Is something that we see with especially our dementia patients, okay? And it's increased confusion, anxiety, agitation, sometimes even pacing that occur in the late afternoon and evening hours. And it's just, as the daylight starts to fade, right, that is when they start to become a little bit more disoriented. And that's why the confusion and the irritation and agitation occurs. And again, for whatever reason, it happens when the sun is going down. And in some, it can go all night. Like I've had patients where it's all night long, right? They're just constantly, why? Not even sure why it occurs. Okay. But yes. So,
Would it be
um,
would it one be one good answer for that? Since you're going to help them to make the complex tasks in the morning or before.
okay. So do it in the morning.
What about 2?
That's what I think too, so they can be in the
2.
bed before sundown, so they can
But
like
what happens if we put them down that early?
They get up.
They will wake up early.
Yeah, they gonna get up. But
It's
Yeah,
probably 4.
I still say 2.
what does 3? What can you read 3 and 4 for me? I'm sorry.
you're fine. 3, it says encourage the patient to take a nap between lunch and dinner. And 4 is assist the patient with attending a fun and interactive social event after dinner.
No.
Oh, 4 might be good because it'll tire them out.
But what will it do as far as stimulation?
We will increase the stimulation and we want them to be relaxed before bed or at
Well, I
that.
don't know. I don't know what to do to the
I don't
people.
think it's a nap because if they take a nap during the day, they're not going to be tired at night.
For me, I
True.
would say a 1.
I still say 2.
One. We got a 1, we got a 2, we got 3. All right. Most of y'all are saying 2. All right. So I'm gonna hit submit. Okay. So I should have
We
hit
went
1,
1.
right?
Mm-hmm.
So complex tasks should be done in the morning. Sundowner syndrome can occur in cognitive disorders such as delirium, dementia, or Alzheimer's. Behaviors such as confusion, wandering, suspicion, agitation, or restlessness occur in the late afternoon, may continue into the night. Early bedtimes may be convenient for the staff, but are not necessarily in the patient's interest. Discouraging daytime naps and performing bedtime rituals may be helpful in establishing a regular sleep schedule. Interactive social activities in the evening hours may increase confusion. So we'll do the complex tasks in the morning. But yes, sometimes, and I don't know if anybody's ever dealt with anybody that is sundowning, but it takes a lot of patience with some patients. And so, the key is, especially in the evenings, when they start to sundown, you want to decrease the stimulation because stimulation is going to just increase their agitation. So none of them really are effective other than do the complex tasks in the morning when they're the most alert. All right, last question. We're past time. Nobody said anything. Which action can the nurse safely delegate to the experienced AP when caring for a patient with diabetes who develops symptoms of hypoglycemia? So 1, administer IM glucagon. 2, check a finger stick glucose. 3, drop insulin into a syringe or give IV dextrose. What can the
2.
UAP
So
do?
2.
All
2.
right, send that easy one for last, right?
What did it?
Absolutely. They can absolutely check that finger stick glucose. You guys did awesome. Good job. Good job. And we'll do some more next week or after the exam, maybe we'll do some more questions. But you guys did awesome. Appreciate you guys. Have a great week. Don't forget about your exam reviews, and I will see you guys next Wednesday.
Have a good night.
Thank
Thank
you.
you.
You're welcome.